Hello and welcome back. I'm Dr. Ken Berry, and today I have the pleasure of sharing with you one of the brightest minds in fertility medicine in the entire United States, Dr. Robert Kiltz. You've been helping people conceive for quite a few years. I want you to tell everyone watching and listening just who you are, what you do, and why we should care what you think.
I've been doing reproductive medicine for about 30 years now, and gone the gambit from traditional Western medicine. As a fertility specialist, I own, run, and direct CNY fertility centers between Colorado and Atlanta and up to upstate New York. And I've been focusing on traditional standard Western medicine, but over the last 10, 15 years, we've really worked to integrate a lot of Eastern medicine and how stress, anxiety, fear, our dietary lifestyle and our habits can adversely affect fertility. And it seems to be on the rise for so many young individuals and couples. And so I've really working diligently day and night to bring some ideas that I'm learning from so many like you on helping others conceive either naturally or through some assisted reproductive medicine, including in vitro fertilization.
Yes, and you're an OBGYN by training, you're board certified, and then I think you have a fellowship in the endocrinology of fertility medicine, if I'm correct about that.
I started actually in internal medicine and then switched to OBGYN. And then after becoming board certified and practicing in that a little bit, I actually went off and did a fellowship in reproductive endocrinology and infertility.
And infertility, problems conceiving is becoming quite the epidemic issue in the United States and other modern countries, isn't it?
Well, as we're seeing so many other diseases on the rise, infertility and pregnancy losses and failed implantation are all similarly inflammatory and metabolic disorders. So we're seeing it on the rise. Besides the fact that so many young people are postponing childbearing until they're ready into their 30s and 40s even. But we're seeing more and more young women in their early 20s and before, as I've heard you talk about polycystic ovarian syndrome and ovulation and many other diseases, which are all related to metabolic disorders and inflammation.
Yeah, I think the two paradigms of hyperinsulinemia and chronic inappropriate inflammation, I think those probably account for most cases that are not from an anatomical cause. Laura just said, she's from Ontario. She said that 5 years of infertility, went keto 7 months later, and she's knocked up. Congratulations, Laura. And I actually, when I was very early talking about keto with my patients, I was just using it as a temporary weight loss hack. I didn't know everything that I know now. And I had a couple of women, one was 48 and one was 51 years of age. Both they came separately to the clinic at different days, and they were furious with me. And they said, how come you did not tell me this keto would get me knocked up? And I said, well, now, wait a minute. I don't think keto got you knocked up, but it probably did move all of your hormones and all of your lab numbers to the sweet spot where you could get knocked up. And both of these women were just perimenopausal, right? They were already starting to notice an irregularity to their period. They were already starting to notice diminished periods. And both of them went back to having full periods, and both of them got knocked up. But it was about that time when I started thinking, maybe this is more than just a temporary weight loss hack. Maybe this does more to the human body than I assumed initially. So let's, I guess, jump into this. Let's talk about diet first. I think that's probably the foundation of all human health. And I think that being fertile and being able to reproduce, that's kind of the ultimate symbol that you are a healthy specimen. So let's talk.
People say to me, well, I'm healthy and I'm infertile. And so we go down the list of, do you have any medical conditions? And the answer is, well, no, I don't. So they're healthy, but they're not conceiving. And I say that reproduction and ovulation and sperm function are all basically the bottom foundation of the signal of health and wellness. If you're not reproducing naturally, there is something wrong. And some 15 years ago, I was delving into the mindfulness and the stress and brought in yoga and meditation and things. And then some of these patients were getting pregnant that I couldn't get pregnant. And gee, I was thinking all the meditation and all the de-stressing, but they were doing this thing called paleo. And then I started learning about paleo and then keto. And then I started learning about carnivore and this thing called inflammation and how it's all linked. And no one wants to talk about politics, religion, and diet. And, that's the one thing that they don't want to hear about. And so I became a crazy man to talk about it when no one wants to talk about it. And it's something that I never require anyone to do a diet, nor do I ever tell anyone they need to lose weight. We are simply here to give them advice and information to inspire them to really find some different answers and different solutions, for sure.